Good morning, everyone. I hope you can hear me okay. Um, I think it's 10:05, so we should make a start. My name is Anastasia Kalea, and I'm the Academic Program Director for the MSc in Obesity and Clinical Nutrition at UCL. And I want to welcome you to our online open event. I know that you're joining from different parts of the world. If we have an American here or more than one, happy Thanksgiving. I want you to spend a little bit of time letting me know where you're attending from. We usually have people attending our programs from many different countries, which makes the whole experience very exciting. So I would love to hear where you're attending from. You can scan the QR code or go to menti.com. And when prompted, you can use the code 83605159. And this is an anonymous board, if you're wondering. I'll give you a minute to do this. Welcome to people from Saudi Arabia and from Taiwan. England. Fantastic. So I think we can keep going while some of you are still adding your answers. We developed a new program a few years back. I think this is the fifth year that this program is running on obesity and clinical nutrition. And this program came out of a need to spend a little bit more time talking about obesity and training people on obesity and weight management. I said a need because we have been running a program on clinical nutrition and public health for close to 20 years now, a very successful program. And many of our graduates were coming back to us saying, can we expand, please, the teachings on obesity? Because most of the clients and patients we are advising, they're struggling with their weight. And we need some more skills to support them. And indeed, we have a lot of people worldwide, not just in the UK, living with overweight and obesity, and understanding how diet, nutrition, behavioral approaches, and the interact and the wider impact on health is essential. So this program was designed to offer specialized training in the clinical and scientific basis of overnutrition and obesity, and go from weight management from the prevention spectrum, so public health measures or interventions we have for community nutrition settings, to the therapeutic approaches treating obesity. And I don't have to give you statistics to convince you that obesity is a problem that we have been investing a lot on. It seems that obesity has nearly tripled since the mid 70s. And in this country, in the UK, 2 out of 3 adults, they are living with overweight and obesity. Most of the world's population live in countries where overweight and obesity now not only is a public health problem, but also is linked to highest mortality. It used to be underweight, but now we are dealing a lot more, especially countries that have undergone rapid economic development. So we see these rates of obesity prevalence increasing even higher. And based on the existing trend data and the epidemiological data that we have, obesity is linked with a variety of physical but also psychosocial health conditions. So it we do look at it as a public health crisis, and that's why the need to train people to what is the evidence base and what do we do with that. Now, I said earlier that 2/3 of those of adults in this country, age over 35 years of age, they live with overweight and obesity in England. But then worldwide, it seems to be the case as well. A lot of women and a lot of men are living with obesity, and that's data from the World Obesity Federation, and that's 650 million around the world. So because of this affecting a lot of people and being associated, as I will talk to you in a minute, with a lot of complications, health complications, there is a need to train practitioners like yourselves to tackle this earlier, but also be effective in delivering treatments. Now, here's a slide that talks about, I'll start from this side. It talks about the fact that obesity, which we define as a disease that is associated with increased adipose tissue, increased accumulation of fat in the body. So obesity as a disease, because of this accumulation of adiposity, is linked with multiple comorbidities. We do have patients living with a disease, not only having complications in their metabolic functions, in the cardiovascular system, in their liver, in the blood sugar, blood glucose levels, but also mental health complications, depression, anxiety. And I'll talk to you about the aspect of living with a disease like obesity, which is hard to hide. It's not like other diseases, and that comes along with the stigma, that comes along with conscious but also unconscious biases which affect the individual's health and mental health. It also comes along with complications like asthma, infertility, and a variety of cancers. We have people living with obesity at a high risk of cancer. And all of these affect the person's quality of life, obviously. And some of the problems are because of the extra weight, so the mechanical aspect of that, in the joints, chronic back pain, but some of them have to do with metabolic complications and central nervous system complications. There's a lot of risk factors. It's a multifactorial disease. We know that sedentary lifestyle is affecting it, overnutrition, which we will talk a lot talking about. We will spend a lot talking about genetics. We know that our appetite responses, up to 78%, they're based on our genetic background. The environment, we will spend a lot talking about the food environment and how this has changed the last few decades. But also, I'm saying that something that we're not very good at admitting and talking about is the socioeconomic status, these socioeconomic factors. And I'm saying that we're not very good to talk about that because it's really hard to tackle that kind of risk factor for obesity. But we do know that people that live in in deprived areas, they have higher risk of obesity and low access to treatments. And here's the health consequences that I mentioned earlier, starting from metabolic dysfunctions and cardiovascular disease to a variety of disorders that affect quality of life. At the same time, this MSc started being developed in 2000, and in 2000 was the first year we ran online because of COVID at the time. But the expansion of the anti-obesity medication that is available the last 5 years is remarkable. And I'm proud to say that our group at UCL has been involved in the large clinical trials that tested these medications. They have been involved in a variety of current research that is happening. So I cannot think of a better place for somebody to study. Of course, I'm biased to study about obesity, because the scientists that they will be teaching you, they have been writing the papers on these clinical trials. On bariatric surgery interventions, on what do we know about ultra-processed foods and whether we're ready to include them in recommendations. So, but going back to the medications, medications like semaglutide or a variety of incretins that are available now, they have changed the way that we treat this disease. And where do we, whether we have enough tools to support the patients that go out of the semaglutide treatments, and a lot of other questions that we have unanswered, and we're trying to tackle, such as what is the impact of semaglutide on metabolism, on fatty liver and complications, and other incretins apart from the weight, is something that we're studying, and you will be the first to learn from the experts. We do follow international accepted frameworks of obesity as a chronic disease. Obesity has been reframed as a chronic disease because it's not just the weight, it's a complicated pathology that is underlying, and the weight is just part of the phenotype. So rediscovering the appropriate narrative helped us a lot into setting appropriate management goals, and we're hoping to train you in that. Working on this paradigm shift and engaging with the patients a bit differently, we're hoping that it will make you more effective practitioners in addressing this complication that is of a chronic nature. So we're asking the individuals to adapt specific changes in their lifestyles for a very long time. However, we are guiding the individuals by having an appreciation that the individual is here in the center, but there are a lot of factors around them that would affect their behavior. This image is from a report that was produced by the UK government. It's called the Foresight Report. That was a program that was funded to tackle obesity as future challenge. And it explored what are the areas that we need to tackle to respond to the rising levels of obesity. That's the obesity systems map that sometimes it's shown like the way that I'm using this today to explain how complicated obesity is as a disease. So talking just about interventions in the individual is very limited. We need to have a far more balanced perspectives about the role of the individual in relation to the food that they consume, their psychology, their activity levels, and the biology, and look a bit outside at the societal influences and the food production systems in the activity environment. You will have architects that talk about the design of cities, talking to you about things like that, or behavioral scientists on how do we promote messages about health and what have we been doing wrong. So the poor diet and physical inactivity is as drivers of excess weight. Yes, we're aware of that, but we do know as well that some individuals are biologically more susceptible to weight gain, and recognizing this will allow us to approach this impact of the environment on the personal choices, if you wish, with a very different perspective. So this interaction between the environment and the individual is key in guiding people on how to manage the weight. As I said, as a university, we're very proud to be in the forefront of research. Since the inception of this program, you will interact with a range of high caliber partners and experts, scientific and clinical. You will have the opportunity to be involved and be taught with some by some of these partners. We have the UCLH Bariatric Center for Weight Management and Metabolic Surgery. We have the NIHR Obesity Policy Research Unit. We have the UCL Institute of Epidemiology and Healthcare Behavioral Scientists talking to you, or the Bartlett Faculty, which is our School of Architecture. And a lot of them will talk about a lot of barriers that we have that impede optimal care delivery to patients. And I'll talk to you a little bit about how this became the vision for this program. Our goal is for you to develop a very strong grounding in the theory and application of nutrition, in prevention, but also in treatment of obesity and its complications. We want you to be very clear about the causes of obesity, what can we do in prevention, and what can we do in treatment? How do we follow up after this treatment progresses? What is the best practice for clinically treating overweight and obesity? And just a pause here to say that I have seen a huge change in these teachings. They change annually in our courses because we're trying to provide the latest, up-to-date, state-of-the-art research and guidance in the area. What are the public health nutrition issues and strategies? When this course started, we were talking about the sugar tax. Now we're talking about results from what the sugar tax taught us and comparisons around the world just in 5 years. So this is not a course that was designed and has been the same. We evolve every year just to reflect what has been happening in this really rapidly evolving area. And of course, you will have the opportunity to understand, to develop research skills. Some of you have that experience from your previous studies, but some of you will have this opportunity to do this in a research-focused university like UCL. We're very proud of our research-led education. So you will develop these skills, but then you will have the option to conduct your own research project. And along your studies, you will have the opportunity to develop a variety of skills, intellectual skills, academic skills, but also practical and research skills. So the latest evidence, delivery of latest evidence is on the treatment of obesity is something that we will do, but also you will be up to date with everything new that is happening out there. How do we deliver this teaching? During term 1, which we start in September and deliver term 1 until before the winter break in December, mid-December that is. We teach on 2 days, Wednesdays and Fridays. And that's because, but these are 2 full days. This is because a lot of our graduates decide to work or have other responsibilities during the rest of the week. And we have 2 days that we teach you from 9 a.m. to 5 p.m. And then the rest of the days, you will have the opportunity to work on your assessments, to revise your teachings, and to do group work very often, or to prepare for assessment. Then we have the winter break, and we have term 2 from January to March. Now, from April onwards to the end of August, this program terminates. You will focus primarily on your research project. There are some assessments happening through the summer, but there's no delivery of lectures. If you wish, from April onwards, it's only focus on the research project. In term 1, we start you with modules that are shared between other MSc nutrition programs. We have the MSc in Clinical Nutrition and Public Health, the MSc in Eating Disorders and Clinical Nutrition, the MSc in Dietetics, and many of you share some of these modules on basic research skills or practical nutrition assessment methods, etc., or basic metabolism. Now, from term 2 onwards, you will attend some of the shared modules in black here on the clinical nutrition aspect, but then 2 of these modules will be designed to focus on obesity. So this module 105 we'll talk about obesity and weight management, and this one we'll talk about obesity and public health. The two bespoke modules, the obesity and public health talks about this part of this triangle, which we call the tiered approach in the UK for weight management. So tier one is all the environmental and population-wide services and initiatives, all the interventions we know that have worked for populations. We'll talk about some of the weight management services that we have offered. In the obesity and weight management module, you will talk about more complicated aspects of obesity. You'll talk about bariatrics. You will talk about changes in anthropometrics with medication. You will talk about multi modal treatments, and you will have the opportunity in this module on obesity and weight management to go into the clinic or talk to our patients that participate in trials and shadow some of these clinics to see how this service is delivered. So in public health module, when we talk about prevention, we will talk about all of these layers that we often ignore when we provide solutions for a long-term complex disease as obesity. It's not just whether it's a high-fat, low-fat diet that will be effective. It's not just the high fiber or low simple carbs. It's not the high or low ultra-processed food that we will look at. We want you to appreciate that this is just one layer of a very complicated story. So individual factors interact with somebody's dietary choices. The food environment that they live interacts with them. A variety of sectors of influence, like the way that food is food labeling is working, or the food claims, or the regulation of that applies to retailers, or the taxes and the political environment. All of these would affect this ecosystem that we live and do have an impact on a complex disease like obesity. I said earlier that we had, when we designed this curriculum, we had one very clear vision of what exactly we want to do. And this vision came because we try to engage with patients living with overweight and obesity and ask them how happy they are with the options that they have available for them to manage their weight, and what would they like the healthcare practitioners to do better. And there was a consensus of, and that was very clear during COVID years, there was consensus that they feel stigmatized, they feel that they're discriminated because of their weight. And even in the healthcare setting, which is supposed to offer a safe setting for them to seek help, this communication with the healthcare teams is not ideal. We started looking at that along with an international movement at the time. This event took place in February 2020, right before the biggest close downs around the countries, around different countries, on tackling obesity stigma. And at that time, we were producing a large study on what kind of training methods for healthcare professionals are effective in their educational environments to reduce their weight biases, often unconscious weight biases. So our project was on how do we transform care through education and tackle obesity stigma. And this MSc was designed with this in mind. My team published this data to provide a map for educators, but also practitioners as well. And that was picked up by a variety of media around the world. And this was our mission, how to educate people like yourselves to be aware of the stigma, to be aware of the real causes of obesity, and how this awareness will allow better communication with the patients, how can we help you build these skills for better communication, compassion, and empathy to allow us to work with our patients better. Part of this training is for you to get to know the people that you will be helping, to get to know the people that will be living with overweight and obesity that will come to the clinics, and interact with the people that uh, support their treatment path. So if this is something that you are interested in, and if this is what you expect your graduate degree to offer to you, please do join our programs. We love having people from many different parts of the world because they come with very different experiences, and the discussions we have in class are extremely beneficial. And I'm very excited when our graduates come back to say, I set up my clinic, I set up a practice. What I say is very different from what everybody else is doing, and I think I can help people more. So when to apply for this program, you can have the information on our webpage. The applications are already open. We had our face-to-face open day at UCL last week, and that was the question. These were the questions that I got. When are the applications open, and how fast can we apply? As early as possible is my advice. Keep in mind that you can submit applications for a maximum of 2 graduate courses in any application cycle. And if you need a visa, these are the dates for the application. If you do not require a visa, you have a little bit more time to send your application. This was all from me. Hopefully I gave you a flavor of what we're trying to do and what we have designed for you. And I'm very happy to take any questions. Any comments? Anything that you like from what you heard, if it's not a question? Anything that you would like to see in the course? If you join? If you prefer, um, yes, if you prefer to talk instead of writing a question, by all means, just raise your hand and um, I can answer any question you may have. You are permitted to unmute yourselves, or let me offer another option. How about okay. Some of you may be more comfortable sharing, asking a question anonymously. So if this, um, if you can see my screen, you can type your question there. Okay. All right. Thank you. I'm glad that everything was clear. Um, there's a question that says somebody has a master's of pharmacy. Do you usually consider someone with that degree? I would say yes. It we ask people to have some kind of background in biology, which I assume that you do with a master's of pharmacy. That's a question for admissions really, but the background is something that would qualify. Basic understanding of metabolism, again, I expect somebody with a master's of pharmacy to have, so you should be absolutely fine. Another question says, is this program likely to fill up quickly? If I don't have the time to take the language test, would you recommend applying first to get conditional offer? This is really, again, a question for admissions. I would say that most of the applications arrive before March, April time. Um, so based on when do you plan to take the language test, and whether you need a visa or not, and all these details, that's a personal choice for you, whether a conditional offer would make sense. Mm. Anything else? Thank you very much. There's a link that was pasted about the admissions inquiries. You can find these links online as well. Look at the Mentimeter. I don't have any questions on the Mentimeter. Um, how many students usually accepted in the program? We don't have a cap of students. Um, so it depends on the year, I would say, and sometimes the applications come. A lot of applications come around a specific time. That probably has to do with when people graduate and they know they're a bit more confident of where they know they're going. Um, it is a small. We're trying to keep it a small cohort because of um, the clinics, but we don't really have a cap. When the numbers become a bit unmanageable, then we would have a discussion. But we haven't had this problem in the past. We still have a lot of rooms at UCL to feed people. Um, but the reason that this program is a bit more bespoke, if you wish, is because we want to spend a lot of time interacting with the patients and have a more focused delivery of teaching. You won't have 100 colleagues in these obesity-focused teachings and sessions. No more questions on the Mentimeter either. Anything else? Somebody asked how to apply. You can find our prospective students, graduate, and how to apply on our website. There's a link for you to access. if we don't have any more questions, gonna wait for a minute or so. Then I think we can wrap this up a bit earlier. I'm always at your availability if after we finish this session, you have questions. You can find my contact information on the UCL Profiles webpage. It's Anastasia Kalea, and I'm happy to answer any questions you may have on the program, any practical questions you may have. Okay, I have one question. Is there an opportunity for clinical learning in this program, or are there any requirements for the thesis? Opportunity for clinical learning. Well, the obesity, there's a lot of taught content on clinical nutrition, if that's what you mean. I'm not sure if that's what you mean. You have from term one, you have lectures on clinical nutrition, and that will have to do with knowledge on clinical nutrition in a care setting for premature infants to clinical nutrition teachings in geriatrics. So we follow the life cycle approach in our program. So we talk about many different groups of the population. It's obesity and clinical nutrition. It's not just an obesity course. So you will have a lot of this information there. So apart from that, if you're talking about clinical nutrition and obesity, we have this 105 module where you will develop your skills on supporting clinical treatment of obesity as someone with nutrition skills. Requirements for the thesis are for you to have attended the research the 3739 module, which is the research skills and nutrition assessment skills. So that's when you talk about, you will be trained on statistics and analysis and different types of study designs, ethics approvals. So these, yes, would be requirements for the thesis. And before you're assigned to a project, which is around Christmas time, no, actually it will be January. And the program, I remind you, starts around March, April. So before you're assigned to that, you will meet with a supervisor, because you can imagine that if we have the division of medicine, you will have access to maybe 150 potential titles. And some of my students are often asking, depending on the background, they're asking to work on a specific area that inspired them, even if it's not obesity per se. It may be cardiometabolic complication or something that has to do with fatty liver disease, something that goes along the line of the comorbidities of obesity. And that's absolutely fine. So when they decide to do that, they need to talk to the supervisor and meet with the supervisor. And so any specific requirements about this is any additional training will be delivered by in agreement with the supervisor. So in that sense, no specific requirements. It's not a job application that you need to know something before you apply for a project. It's a training opportunity, the research project. I have another question. Are you able to choose your own research topic based on your interest, or are there topics we have to choose from? Both. So there will be a list, and we make sure that there's a few options for all of you. And you can choose 4, I believe, different projects. And most of our students are allocated on one of the 4 titles. You're supposed to have a brief meeting with the supervisors of these 4 projects before you decide, because we want you to know what the project is about. That was a requirement in the last few years, because students would look at the description and the title and they get excited, but then they would come back saying, oh, I didn't realize I have to collect data from the patients and I don't like it. or I didn't realize it was all computer work and I want to have interaction with the patient. So to avoid this, we want you to talk to the supervisors and find out what the type of project is about. Now, do you have the chance to pick your own research topic? Absolutely. And I think these make very fascinating projects as well. A couple of times every year, I have a student coming with their idea. And sometimes they have identified a supervisor, or they come to me with an idea, and we're trying to match them with the supervisor. UCL is huge. We have a lot of professors that are experts in the field. Apart from food science topics, which may be not in our direct area of expertise, but we will still look for a collaborator in another university for this. So we have a variety of experts that could supervise you on a project. And if you come with an idea that would cover a gap in research, most of the people would be willing to offer supervision. I had myself a student coming to me after from the clinical and public health nutrition project, coming to me saying, I really got inspired about this iron fortification study in the Gambia. Can I go there and work on this project? And if you write a nice email to the people that work on this field, and UCL has very good relationships around different institutions, we wrote to the MRC researchers. They agreed to supervise the student at the Gambia. UCL supported her for her vaccinations, insurance, whatever it was needed. She spent 2 months there, came back to write the dissertation, and actually it was such an amazing experience that she continued on a PhD at King's College London afterwards, after meeting a professor there from there. And she was back last year talking to us about how it all started, and her whole life changed after this one lecture she attended. So yes, if something inspires you, if something uh, is you're extremely interested about something, usually these are the best projects, and I encourage you to come and talk to me once you join us. Because if you love reading about a topic, a specific area, you will you will do an amazing job in that. And I'm always interested to make this work public and publish your results even. I was wondering how much the course is involving clinical nutrition, since it appears that the course is more focused on obesity. Although I understand clinical nutrition plays a huge role in obesity management, I would say quite a lot. Um, and I'm saying it with the risk that many of you will be interested primarily on obesity. But I would say term one, the disease-related malnutrition, talks about clinical nutrition and the molecular pathways of disease. On the second term, I would say 50% of the teaching is on clinical nutrition. The other 50% is focused on obesity. So you have the therapeutic management of obesity. You will talk a lot about parenteral nutrition and enteral nutrition and all of that. You will talk about the liver, you will talk about the kidney, you will talk about lots of complicated stories that clinical nutrition will be relevant. And then the last module, which is delivered by our UCLH team of gastroenterologists, is on disease and disordered eating. You'll talk about eating disorders there, but not just there. Any kind of disordered eating that will require clinical nutrition support. You'll talk about allergies. You'll talk about many different things. You're not trained to be dietitians, but you will have a very good taught content on clinical nutrition, is my answer. The differences between dietetics and nutrition. Okay, so somebody that is studies nutrition, they are allowed to practice by providing advice for not very complicated diseases. A treatment in dietetics, a training in dietetics comes with a lot of practical experience as well. So dietitians have to have something like 1,000 hours in the hospital to be trained in placement. We have an MSc in dietetics program as well at UCL, where I teach as well. And our dietitians are trained to manage complicated health conditions, very often in a hospital setting, which will not be something that the nutritionists would do. Our nutritionists would work in a very different, would have very different employment opportunities. I have to say here that most of our programs in nutrition and dietetics are pre-accredited or accredited by the Association for Nutrition. The Obesity MSc is not, because the graduates that this program attracts are already healthcare professionals that would practice in a clinical setting, and they want a training in nutrition outside of a license to practice as a nutritionist or a dietitian. I hope this answers your questions. That being said, very often the Obesity MSc graduates have applied for their Association for Nutrition registration if they want to practice in the UK, and they did receive it. How much patient contact we will have? Well, we engage with our patients to join us in the classroom. So especially for the therapeutics modules and the obesity and weight management, one of the workshops we have on communication skill is co-designed with a patient. In the therapeutics module, you will have patients coming in sessions to talk about their experience. So you will be interacting with patients in the classroom. That's one of the ways. Now, outside the classroom, in term 2, so once you're trained on some basic approaches and in nutrition, you will have opportunities that are optional for you to take. So there will be a list of opportunities for shadowing clinics, which you can sign up by yourselves. And for the 105 module, you will have the opportunity to go every Friday. So one of you is assigned every Friday and a few times per week, if you choose. But this is a very good opportunity for you to understand more the patients. So you will have the chance to shadow a bariatric surgeon, to shadow a dietitian in the obesity clinic, and this can be either face-to-face clinics or online clinics, and you will follow them for a day. So I would say, depending on the day and depending on the clinic, you may see, I don't know, 6, 8 patients on a day. Your role would be there to shadow. So you do go through the DBS checks to go to the hospital and shadow the clinic, but you won't be talking to the patients. You will just take notes. You will have the opportunity to ask questions and interact with in the meetings with the multidisciplinary team in the clinic, which takes place in the afternoon. And I think the value of shadowing the clinics is going to the multidisciplinary team and see what they thought they should do, what approach they follow based on how the clinic went. So it offers that reflection opportunity for you. And something that I'm not sure I mentioned in my lecture is that we do not, we have over 120 invited lecturers in the course. So we will have the people that are experts in this field that they would give the conference presentation coming in the classroom to teach you. If I have the expert that designed the energy and protein requirements for adults for the British Dietetic Association affiliated with UCL, I will bring them to talk to you about this. If I have the person that wrote the book on bariatric complications in the gallbladder, I will bring them to talk to you about it. In a very similar level, I mean, the same applies for many other teachings as well, from basic metabolism to more complicated stories. So it feels like when I attended the clinical and public health nutrition course, which I was a postdoc at UCL at the time, I was under the impression I was at a conference. So it's not your typical teaching environment that you see in many other universities. I was in 7 different universities myself, the student or staff. It's a very unique program, which is difficult to deliver, but that's the kind of experience we would like you to have. And that's what fits at UCL because it's a research-led university. We want the people that do the research talk to you about the evidence and scrutinize the evidence as well, which is the valuable part. That's the skills that we want you to acquire, that critical insight, critical thinking. I think that's what we're missing, all of us. Anything else? I think you have on the webinar chat our Division of Medicine postgraduate email for any questions you may have on the process of applying. You have my email for questions that don't have to do with admissions, but on content delivery, perhaps. Um, any other questions around the taught content of the program? I'm happy to respond to them. It's almost 11 o'clock. Maybe a minute for a last minute question. Let me check the Mentimeter as well. No questions there. Okay. Thank you very much all for joining. Thank you for spending some time to get to know us, and hopefully we'll see your applications reaching our admissions team. Oh, one last question. Saved by the bell. What is the difference between this course and the public health nutrition course? It's the 2 out of 8 modules that focus on obesity. So when the clinical and public health nutrition course talks about community nutrition and food banks and food insecurity and what we do in a prison setting and all of that, we spend more time in an obesity clinic. And when they talk about public health nutrition in developing countries, we focus a little bit more on obesity and public health in a clinical setting. So obesity public health interventions for specific population groups. The other difference is that the public health nutrition course is accredited by the AFN. So if you want to practice in the UK, you will have this accreditation, which is irrelevant if you don't plan to practice in the UK, because this is a voluntary registry that applies only in this country. Thank you again, and have a lovely day.